Rhinoplasty or nose job is basically a surgery in which we improve the shape and size of the nose to make it look more beautiful. In humans, the development of the nose usually continues up to the age of 16 years. So as a rule, we avoid doing rhinoplasty in adults who are younger than 16 years. Although exceptions are there, but we avoid doing rhinoplasty before 16 years. And there is no upper age limit for rhinoplasty. It can be done in any old age also. Rhinoplasty comprises of two components. One, as we know, is the cosmetic component, but there is an equally essential component, which is the functional component. So rhinoplasty involves doing surgery on the surface as well as on the inside of the nose. So for the outer surface is operated to make the look and shape better, and the inner surface is operated to make the nose more functional. That means we not only do rhinoplasty for cosmetic patients, we also do for patients. For example, somebody has got a deviated nose with difficulty in breathing from one side. So rhinoplasty is basically two surgeries combined into one, forming the cosmetic as well as the functional part. There are no specific precautions before going for a rhinoplasty, although the patient should be physically fit. He should not be on any particular medications. He should not be a smoker. Even if he's smoking, I advise them to quit smoking 15 to 20 days before. And other than that, no any specific precautions or before surgery requirements are there. As far as after the surgery is concerned, usually we put a pack inside the nose. Pack is that we put something in the nostrils for 48 hours, which is removed after 48 hours. And in more than 70% of our cases, we also apply a splint on the nose. That is a small plaster which stays for 7 days. So this is done, and after 2 days this pack is removed. After 7 days this is removed. Apart from that, we advise our patients not to blow nose very hard. If they feel like sneezing, they should sneeze from mouth. They should sit a lot, take plenty of fluids. These are the routine after surgery advice we give to the patients. The risks involved with rhinoplasty are just as same as with any other surgery. The common complications which we have seen are sometimes after removal of the pack there might be some intermittent bleeding, which usually stops after resting. There is some contusion. Which is and bruising, which goes off over a period of if we do an osteotomy, it takes usually 2 to 3 weeks to settle down. There is swelling which stays for 4 to 5 days. Apart from that, it is pretty much safe. Rhinoplasty is done as a daycare. The patient after the surgery is allowed to go home on the same day. A patient is although not allowed to drive. We require him to have somebody accompanying him, and the patient goes with that person because of the anesthetic reasons. Patient is up and about on the same day, goes to the toilet, and he's allowed to eat a soft or a normal diet from the same day. Apart from that, the swelling usually takes 7 to 10 days, and more or less the patient can resume work after 1 week. Whatever stitches are there, they are removed on the 5th or the 6th day. If the patient is having a gross deformity or a grossly deviated nose, the results are evident on table. That is, we just do the surgery and we can see that there's a gross and remarkable change. Although immediately after surgery, the edema sets in and the nose swells. So when the patient wakes up, he's most of the time with the plaster. So we remove it after 7 days. At that time also there is a bit of a swelling, so the exact picture is not clear. Usually it takes around 1 month to have a fairly good idea what the nose is going to look like. Though this process continues over a period of months, and the exact final stasis or the final position in which the nose is going to look for the rest of the future is somewhere around 1 year.